All right, today we're working on sutras and stitches. We are going to do a couple of them. First, we have all our materials here. We'll go through it all with our athlete. Let's get our gloves on first. Obviously blood. I don't think this demonstration, you need to. When you do gloves, what I was reading, you're supposed to do your dominant hand, which is my right hand, first, and then you do your left hand, your non-dominant. We will take we'll take like a water bottle, anything that we can use. We'll just pretend we have water and we'll flush out their wound, clean it all around, flush it, get it all cleaned out before we even start anything. Gloves on, that. Followed by that, we're gonna take alcohol and we're just gonna clean it all up. We're gonna use this one tonight for this demonstration. All right, we'll clean it all nicely. Put that to the side. And then what you would do is, because it's painful, I've got the needle, we're not gonna take it out, but we will put the needle on, meds, and then we will, around where we're gonna do the stitches. That way the patient isn't in pain while you're doing stitches. So we'll do that, we'd apply that on there. We'll just put that to the side. These are tools that we'll be using to cut and stitches. This is what we'll use right now for the demonstration. So we'll open our package up. Open this. Keep sterile. You don't want no infections. We have our gloves on, which should be just fine. What I did like doing though is just going and grabbing it with the scissors. And then I will put this to the side. As you can already see our needles here. Just grab this. Pull that, get rid of that. We're trying not to touch the needle as much as possible. So get it nice and balanced. Okay, we'll start with just a single. So we're just gonna go nice. Then we'll go right, just straight across. And then we will bring it up on the patient. 1 second. There we go. So in the videos, we're talking about not pulling this and hurting, as I just felt throughout. We don't want to poke anyone. So just take your tweezers and just pull. See how the rope is, the string is just going through. Let's make this a little straighter so when I get okay, keep going. That way the needle's right here in my control. I'm not gonna poke the patient or anyone around me. We're gonna make it so the rope is nice, the string is straight up. Just gonna flip this, and then we're gonna just go over twice, loop it. I'm just gonna grab this. I'm gonna pull this down, and then we'll just pull that nicely, like so. Now we're gonna bring this up that way. Then I'm gonna go a loop again, grab the tip, pull this down. We're gonna do it a couple times just to show that I have it down, but you wanna do it like 3-4 times. So now we're gonna go again, just one time, not the double like we started off with. Bring this down, and then again, go loop, bring this down, nice strong stitch. So that's our first one we're gonna do. We're gonna do the figure 8. So, but we're gonna clean this up for our patient. So you can't have string everywhere. So cut nice, cut nice. Okay, put the scissors back. Let's grab our needle again. Oops. Again, we're gonna go here, there, perfect. Pull it up. Remember again, like we were saying, we're just gonna pull the string, not the needle out. That way no one gets poked by it and we're all safe. Let's get this sticking straight up for us. And then, like I said, figure 8. I'm just gonna rotate this again. Not touching the needle, not trying to contaminate it. We're just gonna go again, just right next to it. And let's go up on it. Let's pull, let's be careful. Again, just pull. Look at that, nice, nice, nice. And we will set the needle to the side. Take this again, double loop. Grab the tip, pull this through. Okay. Take this, go over, pull it through. Again, we're gonna do it a few times, 4 times, just to show that I got the concept down. Boom, nice. Again, loop it, grab it, pull, nice. Do it again, just one more time. Pull this up, loop it, boom. Okay, and then again, we will clean this up. And there we go. Those are our stitches. Be careful of our needle. So I did figure 8, the straight one. Let's put this to the side right now. We'll put our tools right here. Now we're gonna do Steri-strips. And then I have my patient right here. What we're gonna do is, this is like on the court, just immediate, acute injury. I'm telling you, this black line is the cut. What I'll do again, now we have another syringe, maybe even a water bottle. We're just gonna flush everything out because, you know, just get it done. So let's pretend we're flushing this all out. Again, water bottle too, get everything out, make sure it's nice and clean before we do anything else to the athlete. Take this, another alcohol pad. I'm just gonna clean around it after the athlete. Like I said, we cleaned them all up. Technically, you don't wanna go over it again. So just one time with the alcohol pad, we don't wanna risk any infection. These are the Steri-strips. We open them up. Now not gonna use all of it to cover the wound. What we will do though is we'll take, let's go a little over 3. Let's go 3.5. We'll just go 4 on this one. So we'll go here, set this down, put the scissors to the side. Just gonna fold it, easy to cut. And we are going to just peel softly right here, stay in the camera so you guys can see it. Okay, now what we will do is we'll peel one for now. I'll set these to the side. I'm just gonna squeeze this part for the athlete, and then I'm gonna pull and lay it down. There's one. And then let's do these other 3. We're gonna do the other side first. Again, we're gonna pull in the same direction as I did the first one. Then we'll go to the last one. Pull, lay it down. Now, if you want, you could put a cover over it if you'd like for the athlete, and then just wrap it in PowerFlex till we get to the doctor to have them do stitches. And that is how we do Steri-strips, and that's also how we do our stitches. Again, let's just show you the Steri-strips, and here are our stitches, figure 8, and just the straight line. But that is it. Thank you, and have a good night.